Well, the government is about to subsidise a new medical treatment which helps improve the lifestyle of people suffering from HIV. It's a product which can be injected into a patient's face to overcome the wasted and sunken appearance that's caused by the drugs which those suffering from the disease must take to stay alive. Now, joining us in the studio to talk about it is Dr. Joseph Hkeik of All Saints Medical Clinic in Sydney. Dr. Hkeik, thank you so much for coming in this afternoon. So just tell us first of all about this facial wasting in HIV patients. How prevalent is that?
It's very prevalent. 1 in 8 patients living with HIV in Australia at the moment are suffering from severe facial lipoatrophy.
And how does that manifest itself?
Well, these patients initially start to lose a little bit of volume from their face, but eventually it gives them a more general skeletal appearance, very much the skin and bone.
What's actually causing it? Is it the HIV or is it the drugs?
It's a combination, but the majority of the lipoatrophy is caused by the drugs.
All right, so this new treatment that we're talking about here, how does that work to counteract that?
Well, Sculptra is not a new product. Sculptra is a product, a safe product's been around for about 12 years now. We've been using it in Australia since 2002. Sculptra is a product that is injected underneath the skin, and it promotes the body's own collagen production, and as a result it recontours the face and fill the areas that we need to fill.
So you see pretty good results with it?
Absolutely.
And does it have any side effects?
Like any injectable that we use on the face, there's 4 common side effects: redness, swelling, bruising and tenderness, which will settle within a few days. And in very, very rare occasion you can get tiny lumps underneath the skin, but they're not visible on the skin, so the patient's quite happy with that.
So it's purely an aesthetic procedure?
It's more than an aesthetic, because with the HIV positive patient, really having the lipoatrophy, it causes a lot of depression, a lot of anxiety. It's stigmatizing for them, so it's a bit more than skin deep.
So just give us an idea of what percentage of HIV patients might have this facial wasting, as you call it.
1 in 8 patients will have severe lipoatrophy. If you look at any type of lipoatrophy, more than that, but the patient that will be benefiting from this and their quality of life will improve will be 1 in 8 patients. In Australia at the moment, I think as of September 2008, there were about 28,000 patients suffering from HIV. So 1 in 8 of those patients will be benefiting from this product.
And so does the product work on all of those patients?
The product works on most patients. Some patients will get much better results than other patients, but the majority are quite happy.
So it's a big step to have the drug subsidised, isn't it? That's going to make it a lot more available?
Absolutely. Being HIV positive, you need a lot more product to achieve the desired results. That becomes by itself prohibitive, because it is quite an expensive procedure. So it's a positive step for these patients.
All right, some good news for once. Dr. Hkeik, thanks so much for coming in, explaining all of that.
Thank you, Jacinta.
See you again.